Okay, so I can't decide if you actually want to see me or not, but too bad, you get to see me now. I don't know if it's easier to pay attention or to listen if you can see me, but we're gonna go fast because baby Ellie's sleeping, and hopefully she will stay sleeping until we are done, so that way I can um get this in for you and we can move on tomorrow. So we talked about chlamydia. Yeah, got that. 75% women have no symptoms. So remember, the thing that's kind of scary about having no symptoms is if you don't know you have chlamydia, you might not know that you're transmitting chlamydia. Okay, so we'll talk a little bit more about that. Another bacterial sexually transmitted infection, an infection you can get rid of, or you can go to the doctor and be cured, is gonorrhea. So make sure you put gonorrhea down in your notes under the bacterial STIs, and then you don't have to list every single one of these symptoms. Again, a lot of the symptoms are going to be the same. A discharge from the penis or vagina, we kind of talked about that. You want to know what normal discharge looks like. What is your normal? And when it's different, make sure that you know um, to keep an eye on it. Constipation and rectal bleeding. So that sounds kind of gross, right? Constipation, that can happen for a lot of different reasons. Eat a lot of cheese curds. Cheese salt might back you up. Rectal bleeding, that means you bleed when you poop. So that is not, again, it sounds really gross, but it's not the most abnormal thing ever. If you've ever had hemorrhoids, maybe your parents have talked about having hemorrhoids. Hemorrhoids are just like when around your rectum gets a little bit inflamed and then it can bleed, and that's okay. It's totally normal, but you want to make sure that you keep an eye on it so that if you see some other things happening, that you take care of that. Painful frequent urination, again in men, this is going to be a gonorrhea. It doesn't matter really which STI or STD you have, but you want to know to watch out for these symptoms, because if this stuff is happening, you want to make sure that you get it taken care of. It's not something you probably want to talk about with people, so you want to make sure that you are taking care of yourself and you don't just let it go, because if you let it go and you don't get help, you it can be really problemsome for your body. Spotting between periods for women, again, not all that abnormal. You might not even know. You might not even, probably the first thing that you think of is like, not, do I have an STD? No, you're gonna think, man, I thought I had my period like 2 weeks ago. What's going on? Not gonna be the most abnormal thing, but again, keep an eye out. Women often, again, have no symptoms whatsoever when they have gonorrhea. So just because you don't have symptoms, if you're sexually active, you could possibly have an STD or an STI. The next one is probably something that you heard of, is syphilis. Okay. Syphilis is a little bit different than the past two because there is sometimes a sore on the genital area. And it's painless. You'll see something there, but it doesn't really hurt. You might have flu-like symptoms. Again, when you have flu-like, when you're sick and you're puking and your body hurts, you're not going to think, I have an STD. No, you're probably going to think I have the flu and I need to stay home. We need to be very careful because when we have things like this, if we don't take care of them, if we don't keep our bodies healthy, they can really escalate and can cause death. Like, it's really serious. So organ failure, blindness, paralysis means your body can't move, or death. I think it says picture next, but I don't think that we have a picture, but let's see what happens. Nope. Okay. So remember that when we look at rashes or different things that might be happening in our genital region, pimples happen. They can happen all over your body and they're normal, and that's okay. Okay. But if that pimple starts to look a little bit abnormal, it looks a little bit funny, that's not something you want to ignore. Okay. Even though it might be a hard discussion to have with your parents or other people, you want to make sure that you tell somebody, or that you at least go to the doctor and have it looked at, because you don't want to leave it go and let it get really bad, because bacterial STDs can be cured. The doctor just needs to give you the right medication. You need to make sure that you tell the partner that you're with, and you can be completely cured of that STD. Now, if you don't tell the partner that you're with, what's going to happen? Typically, the partner is going to have the same STD that you have, and that partner is just going to reinfect you. So you might be taking the medicine, but if you're still sexually active with that person is going to give you that sexually transmitted disease right back again. So remember that abstinence is 100% effective. If we are not having sex, we don't have to worry about any of this at all. And condoms are very effective, but remember, we kind of talked about how condoms aren't used properly a lot. They have to be used properly. They have to be used every single time with every single partner for every single type of sexual contact. So that's when we talked about yesterday about flavored condoms and stuff like that, so that if you are having oral sex, or if you choose to do that, we still just want you to be careful so that these things don't happen, because they are very serious. It's not something to mess around with. Okay? Getting more serious is viral STDs, so sexually transmitted diseases. Diseases don't go away. They cannot be cured. You will have them for the rest of your life. Your immune system needs to make antibodies to fight off these viruses, so your immune system can be brought down. So that means you can get sicker faster with all kinds of different things, not just STDs. They can control these things. They can make them happen less often, but they cannot cure them. They do not have a cure, a complete cure for viral STDs. So the first one that maybe you've talked about, oh, I'm trying to move my thing and I can't get it, is HIV, which just stands for human immunodeficiency virus. What happens with HIV is you get flu-like symptoms about 2 to 4 weeks after the infection, and then the HIV stays in your body. So you think, oh, I got the flu, not a big deal, right? And then the HIV is in your body. You're probably not going to notice that it's in your body until you are tested. There is treatment. They've come a long way with HIV. So there is treatment, but that doesn't mean it goes away, okay? People live a long time with HIV now, which before it wouldn't take very long. You'd have AIDS and you would die from the HIV. They're working really hard to treat it, to figure out a way to have people live longer, happier lives once they contract HIV. But again, no treatment for forever. Prevention, abstinence, using condoms. All right, genital herpes. So genital herpes is the ones that you think of like a cold sore on your lip, okay? But that happens in your genital region. So a cold sore on your lip is not an STD. That is a different type of herpes. It's a different strain of herpes. So you are still going to have itchy type blisters on your genitals. So that's again where I'm talking about that pimple that isn't quite acting like a pimple. It's not normal. And then maybe it starts itching. There's a rash. You're definitely going to want to keep a handle on that and make sure that you get that checked out. Even if there's not pimples or those blisters on your labia, or maybe your mons pubis, or for boys, penis, scrotum, if there's not those herpes there, you still have the herpes infection in your body, and you can transmit that infection. Many people who have herpes don't actually get those itchy blisters on their skin, so they don't even know that they have the herpes. So that's a little bit scary. Genital herpes meds can help reduce the symptoms, so the itching, it can stop the itching, the pain, but they're still going to be there. Hopefully help stop the transmission. So once you get a an STD like this, it's yours for life. So maybe when you're in that long-lasted committed relationship later on in life, you're definitely going to have to be dealing with this. So when there's an outbreak, we want to make sure that you're not having sex at all during that outbreak, which can happen as often as every month to maybe just once a year, depending on the type. Genital warts, kind of the same thing. Human papillomavirus. Okay. The human papillomavirus, maybe you've heard of Gardasil, or a series of 3 shots that they're giving teenagers in order to try to stop the human papillomavirus. There is lots and lots of this virus out there, and we want to make sure that we are stopping the spread of this virus, because this virus is what causes types of cervical cancers and different types of reproductive cancers, like the prostate cancer that we had talked about earlier in class. Okay, so again, with the human papillomavirus, we get genital warts. So warts, like you've seen people with warts on their hands. Again, the sexually transmitted disease is a different strain, but you're going to get those warts on your genitals, around your anus, or in your groin, like in between your legs. Not fun stuff. That's going to happen for the rest of your life. The warts, like warts can be flat or like raised up, cauliflower shaped looking, kind of gross, right? They grow, they stay, they disappear. Again, most people have no symptoms whatsoever. Lots of risks, okay? Cancer of the cervix, cancer of the penis, cancer of the vagina, cancer of the anus. All those things, not fun, okay? And I talked about that series of 3 shots with the HPV vaccine. Maybe a lot of you have had that already. The warts can be removed when they come, but they're going to come back, okay? There really is no treatment for this. It just keeps affecting your body, and that's why we want to be so careful not to spread this type of, or any type of STD. Talk about hepatitis B and C, viral STDs, same kind of things, okay? Can cause liver cancer, liver failure, and death. We just really want you to know that these are serious things, that some of the things you can get vaccinated for, and if you're not vaccinated, you want to make sure you're extra careful. Sometimes parents will opt out of vaccinations, and then that leaves you at risk for some of these diseases even more than other people. You can see abdominal pain, vomiting, final stage liver failure. Those are things we don't want to mess around with, okay? Abstinence, condoms, abstinence, condoms, abstinence, 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 abstinence. That's all I have to say, okay? There's other types of STDs. The trichomoniasis is a little protozoa that is in your body that can take over. Same kind of symptoms that we had been talking about. So if you missed any of those on your note sheet, please go ahead and get them on there. Men don't have any symptoms at all, okay? You've heard of probably pubic lice, okay? Different kind of lice than goes what's in your hair, but these are little bugs that crawl around in your pubic hair and burrow into your skin, and those can be transmitted by sexual contact, sexual contact and close physical contact. So you want to be really careful about those, okay? Pubic lice, same kind of thing. If you see redness, swelling, itching, okay, that kind of stuff can spread. Just be careful. What do we got to do about it? Okay, we'll talk about that. We'll talk about this a little bit tomorrow when I come back. But we want to make sure that when you're sexually active, that you're taking the time every year to go see the doctor. There's baby Ellie. I just heard her. So I'm going to wrap it up, and I will see you tomorrow. Please get the Chromebooks put back away nicely, and be careful. Goodbye.